Hey guys, welcome back to Medical Coding with Bleu. Today's episode is all about what are the global days in medical coding. What does this mean? If you're brand new to my channel, welcome. I am Bleu. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit the like button, and at the end of this video helps you, I hope you will share it. Okay, so let's get started. All right, so what are global days? Now, I will read for you what everestvision.com says, okay? I thought this was a very good explanation of it really quickly. Global days. It is also called a global period. It is the period of time during which all the necessary services normally furnished by a surgeon before, during, and after a procedure are included in the reimbursement for the procedure performed. Global surgical package is also called global surgery, okay? Now, it doesn't necessarily just mean a surgeon did it, okay? Some of these procedures can be performed by like nurse practitioners and PAs, so they also count as well, okay? Now, I am going to be reading to you guys some of the stuff from this Medicare Learning Network booklet. It is the Global Surgery Booklet. I keep wanting to say surgical. Global Surgery Booklet. Now, I will leave the link for this down in the description box below. I implore you guys to please read it. It is only 19 pages, and it's not a full 19 pages because, of course, there's, table of contents and all this other stuff. But it's a very good read. And even if your place of employment doesn't, say, oh, read this, read it, okay? Everybody follows Medicare guidelines. Everybody. Most insurance companies follow them. They are the trailblazers. They are the leader, okay? So what they have to say, you should really pay attention to because it is very, very important and it's going to help you. This is an excellently written document because it breaks down everything, okay? And we're going to be talking about how is global surgery classified, the 0, the 10-day, and the 90-day global packages, okay? So let's go ahead and start. Now, is the frequently asked questions, right, from this booklet, it says, is the global surgery payment restricted to hospital inpatient settings? The global surgery applies in any setting, including an inpatient hospital, outpatient hospital, ambulatory surgical center, an ASC, and physician's office. When a surgeon visits a patient in an intensive care unit or critical care unit, Medicare includes these visits in the global surgical package, okay? So, how is global surgery classified? There are 3 types of global surgical packages based on the number of postoperative days. Now, what we talk about, these are the procedures, okay? Some procedures have a 0-day global, some have a 10-day global, and some have a 90-day global. Now, you may ask me, Bleu, how do I know how many days this procedure has? I will be leaving the link for this, and it's got the calculator in the link in the document itself. I will also leave you another link that does offer, like if you put in the procedure code, it will pop up with the number of global days, okay, that the procedure has. Pretty cool, and I love that website. So I will be leaving it down in the description box as well. Now, let's just break down, okay? There are the 0-day global post-operative period, okay? So the 0-day global procedures, they have no preoperative period, okay? There are no post-operative days, and the visit on the date of procedure is generally not payable as a separate service. Now, here's the deal. This is where I get a lot of pushback, this took some time, okay, for people to understand. When a patient comes in, okay, and I'm going to use arthrocentesis, which is the injection for a major joint. It's 20610, okay? I'm going to use that one because it's the easiest one for me to explain. And yes, it is another ortho one. You guys are going to get good at ortho as much as I talk about ortho. Anyway, so a patient comes in and they say, Doc, I have osteoarthritis. My knee really hurts. Can you help me? The doc decides, oh, okay, well, I'm going to go ahead and give you an injection for this pain, okay? And this may be the first time this provider has seen this patient. But 20610 has a 0-day global period on it. What does this mean? This means that the provider is only going to get the 20610. He will not get an evaluation and management code, okay? Well, Bleu, this patient is brand new and he's never seen this patient before. Doesn't matter. According to this, the date of the visit on the date of procedure is generally not payable as a separate service. Unless, and I'm going to add this other little part so that way you guys know, if the provider is seeing the patient for other conditions as well, because sometimes it's not just the one condition. Sometimes they have a few things going on. If there's other things that are going on and the provider is addressing those and the provider is treating them or addressing them and doing additional workup or whatever, what have you, that is completely separate. Then yes, that is separately identifiable service that can be attached to an E&M. And that's when you get the 25 modifier, because that is something completely separate on the date of this surgery, on the date of this procedure. Okay, so that is when that happens. But if the only reason that the provider is treating that patient is for that osteoarthritis on the knee and he's given the injection, then you know that is the only thing that they're going to get. Okay, that 20610. Okay, so I'm just saying it, and it says it right here in black and white. Okay, so these are the rules, and even though yes, it's coming from CMS, it is in the rules. Okay, so that's so you guys know. All right, now moving on, a 10-day global period. Now, there's a nail procedure in podiatry that has a 10-day global period. I can't think of it off the top of my head. Okay, but here's the thing: 10-day global post-operative period, other minor procedures. Okay, so no preoperative period. The visit on the date of procedure is generally not payable as a separate procedure. So it's like the 0-day global period one. Okay. And then the total global period is 11 days. Count the date of the surgery, okay, or the date of the procedure, okay, and the 10 days immediately following the date of surgery. Okay, so that is 11 days total. Now, what does this mean? This means that everything that is related to that condition that they had the procedure for, right, is included for the next 11 days that he sees that patient, and he's bringing him back for like suture removal, dressing changes, and things like that. All of that is included in the global package. So then that means those visits within that period are going to be with 99024, which is that post-operative CPT code, okay? That's signaling that this patient is in the post-op global period, okay, for whatever procedure that they had, which is why I am constantly on my providers to be very detailed. I tell them, please let me know what procedure you did and the date that you did it. So that way I know when I'm looking at this documentation that okay, this patient is still in the global period. And my providers have been very wonderful about doing this and complying, because I tell them all the time, in the outpatient setting, I can only take what you give me on that date of service, okay? So I can't have holes. I need to know. So they go, okay, Bleu, okay. Can't you tell I missed them? I missed them so much. I'm still at home, if you haven't been able to tell. Anyway, moving right along. Okay, so we understand, right? Everything that's included for that particular procedure is included for the next 11 total days, okay? The date of the surgery or the procedure plus 10 more days, okay? So, and then now the big kahuna, the 90-day post-operative period for major procedures. Okay, now follow me, because I'm going to try to explain it, but hopefully it doesn't come out confusing, okay? So follow me. 90-day post-operative period, okay? 1 day of preoperative is included. I'm going to stop right there. 1 day preoperative is included. So this means that in the instance that a provider decides, right? At the beginning of April, he decides, okay, at the end of April, we're gonna have you come back for the surgery, okay? We're gonna see you the day before the surgery for the pre-op, just to make sure everything's okay, make sure you're good to go and things like that. This is saying that 1 day pre-operative, okay, so they're bringing him in the day before the surgery. This visit there's no evaluation and management that can be put on this visit, okay? If this visit is about that surgery, that visit is included in the global surgical package. This means there's no evaluation and management, there's no nothing, there's no 99024, no nothing, okay? Because this visit is included in this package, okay? So that's just the way they have it set up, okay? So if they're doing the pre-op the day before, they need to know that this visit is included in the global package, okay? Now, this is on a procedure that has already been decided, okay? There's going to be a difference, and I'm going to illustrate that here in a second, okay? So the second part says the day of the procedure is generally not payable as a separate service, okay? And then the total global period is 92 days. So you count 1 day before the surgery, right? And then the day of surgery, and then the 90 days immediately following the date of surgery. So all of those visits for the next 90 days that have to do with this procedure and this diagnosis and this surgery are going to be included in the global package. That's when you would use that 99024, because again, that is signaling that this patient is in the global period. Now, all of their cash changes, if they get an infection and they just treat it like with medications and things like that, all of this is considered part of the global package because these things can happen. And there's no separate evaluation and management service for this because all of this isn't considered to be included, okay? Cash changes, dressing changes, if they're putting them in a splint or a sling or anything like that, all of that is all included, okay? If there's any sort of post-operative bleeding, if they don't have to go back to the OR, okay? This is not the OR, but this is like if they had come in with a nosebleed because they had like a nasal surgery and they have to do the packing, and they can do the packing right there, you know, in the office or area, then that is something that is included, okay? That's just a post-operative bleed, and sometimes that does happen. Now, if they're going back to the OR, that's something completely different, and I don't want to confuse you guys, so I'm going to leave that one on the table right there. But I'm just letting you know that that those things happen post-operative, and they have considered this when they've come up with the definition of the global package. So that's why. And I'm going to read to you guys what services are included in the global surgery payment. So Medicare includes the following services in the global surgery payment when provided in addition to the surgery. Preoperative visits after the decision is made to operate. That is very important, okay? Because I'm going to talk about 57 in a minute, modifier 57. Okay, hold on. But preoperative visits after the decision is made to operate. Okay, we already know that they're coming in for this. Okay, that's what this is talking about. For major procedures, this includes preoperative visits the day before the day of surgery. For minor procedures, this includes the preoperative visits the day of surgery. Okay, the day of. Okay, intraoperative services that are normally a usual and necessary part of a surgical procedure. All additional medical or surgical services required of a surgeon during the postoperative period of the surgery because of complications which do not require additional trips to the operating room. So that's why I tell you guys, if they came in with a bleed and they're able to pack it right there in the office, then that's fine. It's considered part of it. But that just said it right there, okay? Let's see. Follow-up visits during the post-operative period of the surgery that are related to the recovery of the surgery. This says it perfectly, okay? This says it perfectly. Post-operative surgical pain management by the surgeon. Okay, because sometimes that'll happen. Sometimes the patient will come in and they're like, Doc, I had my surgery 2 weeks ago and I'm still in pain. And they maybe do an adjustment on the pain medication or like the frequency of the pain medication or the dosage of the pain medication. That's included, okay? Supplies except for those identified as exclusions. Miscellaneous services such as dressing changes. What did I tell you guys? You see? local incision care, removal of operative pack, removal of cutaneous sutures and staples, lines, wires, tubes, drains, casts, and splints, insertion of irrigation and removal of urinary catheters, routine peripheral intravenous lines, nasogastric and rectal tubes, and changes and removal of tracheostomy tubes. Okay, what services, so that's all included, okay? So what services are not included in the global surgery payment? The following services are not included in the global surgery payment. These services may be billed and paid for separately. Okay, this is the part that I was talking about, the exciting 57 modifier one, okay? Initial consultation or evaluation of the problem by the surgeon to determine the need for major surgeries. This is billed separately using modifier 57, decision for surgery. This visit may be billed separately only for major surgical procedures. So this is why I gave that example last time. I get so excited. I get so excited because it's like this. The example that I gave last time is that the patient came in with a fracture, right? And the provider decides to go ahead and set the fracture that day, and he's putting him in a cast and things like that. So he gets an evaluation and management, right, code based on his documentation, and because he decided to put this patient in a cast, which has for a fracture, if you're treating a fracture, it has a 90-day global period on it. Well, wait a minute, Blue. They're not going to the OR, or they're not being put under anesthesia. Like, I don't get it. Like, why would that be considered a global surgical package? Because according to those fracture treatment codes, those have a 90-day global period on them. So that's why you would put that 57 modifier, on the initial evaluation and management level, okay? Say it's a 99204. You would put that, I'm just saying this as an example, okay? You would put that 57 modifier on it, and then you would put the procedure, okay? You would code whatever fracture, if this is a fracture, in this scenario it is, you would pick up that fracture code, okay? That fracture treatment code. So that way you would have that. And obviously, please always make sure that you put the correct modifier on it, like directional wise or whatever. Make sure you put that on there too. So that's how you would get that 57 modifier with an evaluation and management on the same date, okay? Only on major surgeries, the ones that have a 90-day global period on them. So, makes sense, right? It clears mud, right? And then going on, right? Services of other physicians related to the surgery, except where the surgeon and the other physicians agree on the transfer of care. This agreement may be in the form of a letter or annotation in the discharge summary, hospital record, or ASC record, okay? Visits unrelated to the diagnosis for which the surgical procedure is performed, unless the visits occur due to complications of the surgery, okay? Complication of the surgery, okay? And then treatment for the underlying condition or an added course of treatment, which is not a normal part of recovery from surgery, okay? So these have to be like completely out of the normal, okay? It has to be completely out of the normal, all right? Diagnostic tests and procedures, including diagnostic radiological procedures, okay? So if they're having to work up something else, if there's something else that's new, okay? That's why it's saying diagnostic radiological procedures, okay? Clearly distinct surgical procedures that occur during the post-operative period, which are not reoperations or treatment for complications, okay? So if they have something else going on, that's when they're saying that, okay, it's not included in the, it is not included in the global surgery payment, okay? So that is when you have to know the difference, okay? Note, a new postoperative period begins with the subsequent procedure. Okay, so if there's another procedure that's performed, the global period starts again. It's reset, okay? This includes procedures done in 2 or more parts for which the decision to stage the procedure is made prospectively or at the time of the first procedure, okay? So a new postoperative period begins with the subsequent procedure, okay? So if they're having to do this includes the procedures that were done in 2 parts or when the decision is made to stage the procedure. So basically, if they have to go in and do another procedure, it's resetting the clock, okay? So they start it all over again, okay? And then going on for things that are not included, treatment for post-operative complications requiring a return trip to the OR. The OR for this purpose, or the operating room, for this purpose is defined as a place of service specifically equipped and staffed for the sole purpose of performing procedures. The term includes a cardiac catheterization suite, a laser suite, and an endoscopic suite. It does not include the patient's room, a minor treatment room, or a recovery room, or an intensive care unit, unless the patient's condition is so critical that there is insufficient time to be transported to the OR. Okay, so it's very important that you know the location. Okay, this is saying that basically what I told you guys, that if they have a bleed and they're able to pack it right there in the office, that's not a return trip to the OR. Okay, just because they're controlling the bleed. And it's saying that you have to, it would have to go to the OR. Okay, that's when it's not included in the global surgical package. Okay. If a less extensive procedure fails and a more extensive procedure is required, the second procedure is payable separately. Okay? And now I'm not going to get into that one because I don't want to blow you guys' mind. and I already got 22 minutes on here. Okay, immunosuppressive therapy for organ transplants is also not included. Okay? And then critical care services unrelated to the surgery where the seriously injured or a burned patient is critically ill and requires constant attendance by a physician. Okay, so in closing, okay, how are minor procedures and endoscopies handled? Minor procedures and endoscopies have post-operative periods of 10 days or 0 days, indicated by 010 or 000. Respectively. For 10-day post-operative period procedures, Medicare does not allow separate payment for post-operative visits or visits within the 10 days of surgery. So that means no E&Ms, okay, when it comes to that procedure, okay, that are related to the recovery of the procedure, okay, like I just said. If a diagnostic biopsy with a 10-day global period precedes a major surgery on the same day or in the 10-day period, the major surgery is payable separately. Okay, services by other physicians are generally not included in the global fee for minor procedures. For 0-day post-operative period procedures, post-operative visits beyond the day of the procedure are not included in the payment amount for the surgery. Post-operative visits are separately billable and payable. For more information, refer to the Medicare claims processing manual. So, exciting stuff, right? Does it make sense? Or is this totally like blowing your mind? Because when I first started out and when I started learning about procedure coding, this blew my mind, okay? And I didn't learn about this stuff like in detail in school because, yeah, you're learning about it in school, but it doesn't make sense until your boot's on the ground, right? And then when you're actually in it and you're like, oh, okay, this is what this means. I had my good friend, she's my good friend now, she started out as my supervisor at the second job that I had in coding, and she had to explain to me what global package means. She's like, well, that's included in the global surgery. And I'm like, global surgery? Yeah, because that's included in the global package. And I'm like, envelope package. I'm like, she goes, do you know what that is? And I'm like, and she goes, okay. And she goes, let's go over it. Because I had not coded procedures at that point, right? I hadn't been versed in that. You know, all I had done is like evaluation and management, and I had done diagnosis coding. That was the extent of it. So if you feel a little lost, don't feel bad. We've all been there. Trust me, I've been there. So now, guys, please read it. Take the time to read it. I will leave the direct link down in the description box below. So there is no excuse. Read it. It will help you. It will help you to understand. Because once you keep reading it, and then when you get out in the real world and you're like, oh, now I get it. Or even if you are a veteran coder and you're rereading it, it's okay. It's okay to reread this stuff because sometimes we all need a refresher. Okay, so I'm just saying, I'm going to wrap this one up. I hope you guys will consider supporting me on Patreon. I'll leave that link down in the description box below. I have exercises on there, although not official, but I do go over my rationale and my thinking, and we do all kinds of fun stuff on there. So anyway, I hope to see you guys there, and I will wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.